Hello, welcome to All Around Health Talk. If you haven't subscribed to our channel, you know what to do. Hit the subscribe button, put on your notification so that you get notification for every time we post a video. Also, like our video, share our videos, and leave us a comment or a question. Today, we're going to be talking about cervical cancer. What is cervical cancer? Cervical cancer is an abnormal growth in tissues of the cervix, which is found obviously in women. If you do not know what the cervix looks like, we have that in one of our videos on fibroids where we talk about the anatomy of the uterus, the cervix, the fallopian tubes, and the ovaries. Now, like I said, cervical cancer is abnormal growths in the tissues of the cervix. These growths are really very slow in terms of how fast they grow. They're very slow growing abnormalities that may not show symptoms until a person goes for a cervical cancer screening. Now, this cancer is very frequent worldwide. It is like the fourth most common cancer in women, and a lot of women under the age of 45 are affected by this cancer. What causes cervical cancer? The main cause of cervical cancer is the HPV. HPV is a human papilloma virus, which is a virus that is sexually transmitted, and most people who are sexually active will have this infection one time or the other in their lives. Now, what happens is that the human papilloma virus has different subtypes, and most of them are harmless. They can even appear and disappear on their own without treatment. Now, in other cases, you might have recurrent papillomavirus infection, and that can increase your risk of cervical cancer. And also, if you have the subtype HPV 16 and 18, which are the ones that are associated with cervical cancer, well, your risk of having cervical cancer increases. Now, in 99% of cervical cancer cases, HPV were identified, so it's the most frequent cause of the papilloma virus. Now, what are the factors that can increase your chances of having papilloma virus? So these factors are: number one, the HPV infection, persistent HPV infection. That's number one. If you have a persistent human papillomavirus infection, that can increase your chances of having cervical cancer. People who have HIV and AIDS also are at high risk of having this cancer. People who have other sexually transmitted diseases accompanying the HPV infection also have a high risk of having this cervical cancer. People who have a family history of cervical cancer stand a high risk of having cancer. People who use anticonceptive pills have a high risk of cervical cancer, and women who have had vaginal or ovarian cancers, or even the urinary tract cancers, have high risk of having cervical cancer. What are the risks? What are the factors that can reduce your chances of having cervical cancer? Well, using having safe sex using the barrier method, in this case condoms, and also having your HPV vaccine and your screening on a regular basis. Now, talking about risk factors, the fact that you have risk factors for the cervical cancer doesn't mean that you are 100% going to have cervical cancer. And the fact that you do not have any risk at all does not mean that you are 100% not going to have cervical cancer. It can happen. So let's all just take precautions. Now, next thing, symptoms. Most of the cervical cancers are asymptomatic. It means that they do not show symptoms. Most people show symptoms in cervical cancer when the cancer is now advanced. Yes, that's the bad part of this. So this is why we need to continuously go for our screening. Now, what symptoms would you see? You would see pelvic pain, you would see abnormal bleeding in between your periods, you might have bleeding during sex or after sex, you might have vaginal discharge too. All of these are symptoms of cervical cancer. But if you have watched our videos, you would know that you can have these symptoms in fibroids, you can have these symptoms in vaginal infections. So it is not specific for cervical cancer, which is the reason again why we need to go for frequent screening. Knowing the symptoms, what can we do to prevent it? There are two ways basically we can prevent, or three ways we can prevent cervical cancer, which number one, like we've mentioned, safe sex using barrier method. This is to prevent you from having the HPV infection. But the most important ways to prevent these cervical cancers are through the HPV vaccine and the screening. Now, the HPV vaccine, the human papilloma virus vaccines, are available in most countries, and these vaccines are for people, women, ladies, girls between the ages of 9 and 14. Now, in some countries, these vaccines are also applicable to boys. So the idea is to give those vaccines before the girl becomes sexually active, because once you become sexually active, you're at risk of having HPV infections. The second way to prevent this is the screening. Now, there are different ways to screen for cervical cancer. Number one is the pap test, which we all know, the Papa Nicolau. We also have the HPV testing, and we have the VIA screening method. The HPV testing, what does it do? It actually tests for the presence of HPV infections. The pap test checks for any abnormal changes in your cervix. And the VIA, which is visual inspection with acetic acid, uses this acid, basically diluted vinegar, to check your cervix for any abnormal growth or changes within the tissues of your cervix. Now, based on this screening, treatment might be carried out, because the idea of the screening is to check for the presence of precancerous cells. And once you find these precancerous cells, you can treat them before they advance into the cancers themselves. So if you do the screening and your results are normal, which will happen in most cases, then you would not need to do a screening until the next 3 to 5 years, right? And in the case that it's abnormal, you do the screening and it's abnormal, then they will have to do a colposcopy, which is basically a magnifying lens to look at the cervix tissues to see the abnormalities, and if there is need, there would be they would have to do a biopsy to take a sample of these tissues to study it and know if it has cancer or not. Who are those that should go for screening? Well, women above 30 years of age. Basically sexually active women, but women from the age of 30 years and above should go for screening every 3 to 5 years to be sure that they are not at risk of developing the cervical cancers. Now, what happens if we find a precancerous cells? Precancerous cells, which means it's not cancer, it's precancerous cells, abnormal cell growth that can increase your chance of having the cancer if they are not treated. What do we do when we see something like this? Well, there are two ways we can treat that. It could be through cryotherapy, which means basically freezing these cells to destroy them, or it could be through what we call LEEP, which will be using a heated wire to take out these abnormal precancerous cells and destroy them. Now, how do we diagnose cervical cancer? Well, the most efficient form of diagnosis is when you go for screening, there is medical examination, or when you have symptoms and you go to your doctor, your gynecologist is going to examine you and might identify abnormalities and go forward to do other tests that can give us a diagnosis. Apart from examination, we have colposcopy, which I have mentioned already, and we have biopsy. Now, we can do other studies like the MRIs and the CT scans in the case that we want to check for metastasis, or in the case that we've seen an advanced cancer in the cells or the tissues of the cervix. Now, treatment. How do we treat? Like we know, prevention is better than cure. So the best thing is to prevent. In the case that we are not able to prevent and we find ourselves in the presence of cervical cancer, then we'll have to treat. How do we treat? Basically, surgery is the cornerstone for treating cervical cancer. Now, the most effective form of surgery in this case would be the hysterectomy, which is taking off the whole uterus and the cervix and reducing your chances of having a recurrent or reoccurring cancer. Now, apart from hysterectomy, for those who would not want to lose the uterus and the cervix in total, there is conization. This conization is basically taking the part of the cervix that looks like a cone totally out and leaving the uterus and some other part of the cervix in place. Or we could do what we call the trachelectomy, which is basically taking just the cervix and leaving the uterus in place. Now, that's surgery. There are other forms of treatment like chemotherapy, radiotherapy, or chemoradiotherapy. Chemotherapy basically destroys the cell, and radiotherapy will attack the DNA of these abnormal cells and destroy them finally. Now, apart from chemotherapy and radiotherapy and surgery, we have the targeted treatment. In this case, you would have to take some drugs that target these cancerous cells. What these drugs do will be to starve the cells of nutrients, and when they do not have their nutrients, they cannot grow and they die. So that's how we treat. Now, I'm sure most of you would want to know what treatment is best for me. For you to know the treatment that is best for you, you would have to speak with your doctor, and also it depends on your age, the location of the cancer, how advanced it is, what stage it is, and if you want to have kids, or if you've stopped giving birth. So all that depends on a lot of factors, which means that you will need to talk to your doctor about treatment. You and your doctor will have to come to an agreement on what kind of treatment is best for you. Now, most people would want to know what happens with pregnancy and cervical cancer. Well, women who are pregnant with cervical cancer at the same time, depending on the stage, can actually give birth. If they're in stage 1, that is not really a big deal. They could actually have vaginal birth, but in most cases, it would have to be a C-section. Now, all of this still has to be discussed with your doctor to know if treatment can be done while you're pregnant or after you're pregnant. Everything depends, because some treatments do not go hand in hand with pregnancy because they are dangerous to your baby. So all that really depends, and there are other treatments, very few, that can work hand in hand with pregnancies and will not affect your baby. So at the end of the day, discussing your treatment regimen with your doctor is of utmost importance. So that's all we have on cervical cancer for you. If you have any question, if there's something you didn't understand, please let us know. Send us a message, leave us a comment or a question, and we'll get back to you. Thumbs up, share our videos, and subscribe to our channel, please. Please share our videos to other people so that everybody can learn about cervical cancer. This is very important for women and also for men. So thank you for watching, and we'll see you in the next one. Bye-bye.